Today in America, a majority of people will experience severe back pain at some point in their life. For those that have back pain, 7% may evolve into severe back pain, which may include symptoms of having a hard time walking, too much pain to sleep, and too much pain to move. Not only does severe back pain affect quality of life, but it can develop into other medical symptoms. Today, we are talking with Dr. Hyder, located in Munster, Indiana, with an innovative back procedure that's helping patients walk out of the outpatient clinic pain-free.
The ideal patient is someone that presents with back pain caused by instability, who has failed conservative management. That's the most important thing we can stress, is that they've failed conservative management, because almost the majority of patients that we see in the office can be treated with physical therapy, anti-inflammatories, injections, chiropractics, and the majority of them do get better. So when a lot of people hear the name surgeon, they automatically think that they're going to wind up with a surgery, which is completely untrue.
Our investigative reporting has discovered a new medical procedure by Dr. Hyder that's quickly changing the lives of those suffering with debilitating back pain. After speaking with Dr. Hyder and his team, we discovered this procedure is minimally invasive, has quick recovery time, and is on the cutting edge of back surgery procedures. Patients properly treated do not have to live in severe pain and can return to a normal lifestyle in a short period of time.
The technique that we're going to be using is a minimally invasive approach called an MIS TLIF. So briefly discussing the transfemoral in-body fusion performed in a minimally invasive way. If you look at the traditional open fusion decompression, it's performed with a midline incision. Now, the way we are going to be performing the surgery is making two small incisions, about 3 centimeters on each side, and dialing in with some tubes and doing all of our work through this opening, where we go ahead and make room for the nerves and the spinal canal. And then what we'll do is we'll tilt the retractor so we can visualize the other side. The procedure itself lasts about an hour to an hour and a half, and most of our patients can be done in an outpatient setting and to go home the same day.
Dr. Hyder is not only helping patients become pain-free, but also invents and develops new spinal technology. In addition to inventing this technology, Dr. Hyder also makes improvements and recommendations to existing spinal procedure technologies. These innovative procedures and cutting-edge technologies are finding their way into medical journals all over the world, and Dr. Hyder was recently awarded as the #1 best of region spine surgeon. Dr. Hyder's innovative spinal surgery is taking the fear out of having this type of back procedure due to quick recovery time, minimal pain, minimal blood loss, and can be done in an outpatient setting. Patients we talked to were surprised about how quickly they recovered and were happy with the overall results.
Well, actually, I was going to get surgery by another doctor. My girlfriend suggested that I do much more research on who's going to do my back surgery, being that she had neck surgery and didn't go well. I looked around at probably 15 different doctors, wound up coming here because the consensus was that Dr. Hyder was one of the better surgeons around. The fact that he does it minimally invasive, and the success rate by the patients that I talked to, they were all really happy with the outcome. And it just got to the point where I couldn't walk anymore. In fact, I was at a grocery store, bent down to pick up a few cases of soda pop, and I couldn't get back up. In fact, they had to carry me out of the store. Got better after a couple days. I couldn't hardly walk. At that point, it was time. I had to get something done. But after, I think it's 6 weeks now, I can walk great. Hell, I could probably run if I wanted to.
To see what he brought with him as far as minimally invasive procedures and the time frame that it took to do surgery, the limited blood loss. I was completely amazed that patients went home the same day. Today's procedure was 44 minutes and will do very well. Now that I am his office manager, I'm actually able to see patients come in prior to and see the pain that they're in, see the deficits, see the complaints and what they have, why they're there to see him. And so once I've seen them, I get to see them come back from surgery and how their pain is relieved, how happy they are. There's so much appreciation for those patients when they come back.
Becoming well known in the medical community for this procedure, Dr. Hyder provides seminars and training to surgeons around the world to teach doctors about this new spinal surgery. Dr. Hyder frequently has the opportunity to share his methods and technologies, to expand his knowledge with the medical community, and is changing lives every day all around the world.